coming up, we'll be on location at Synergy Spine and Pain Center in Glenndale, Maryland, discussing the latest advances in pain management and how they can effectively treat pain, improve your health, and help restore your active lifestyle with one of this region's top doctors, Dr. Madhavi Chada. Dr. Chada is a highly qualified interventional pain management physician and is triple board certified in anesthesiology, internal medicine, and pain management. Dr. Chada completed her dual residencies in anesthesiology at Brookdale Medical Center in New York and in internal medicine at SUNY Stony Brook in New York. Dr. Chada completed her fellowship in pain medicine from Tufts University Bay State Medical Center in Massachusetts. Dr. Chada is an active member of the American Society of Interventional Pain Physicians, North American Neuromodulation Society, and the American Society of Anesthesiologists. She is also affiliated with the American Medical Association. She is the founder and medical director of Synergy Spine and Pain Center. Dr. Chada is committed to high-quality patient care and is unwavering in her dedication to providing personalized treatment and is widely recognized as one of this region's top doctors. Welcome, Dr. Chada. It's a pleasure having you on our program today.
Thank you, Rocco, for having me.
It's your first time, in fact, on our program, and we have a lot to talk about. We're going to be hearing from a patient of yours a bit later, but I wanted to begin, if I may, talking about the significant advancements that have taken place in pain management treatments over the last few years. And I wanted to have you please tell us what some of these effective treatments are, because so many people are suffering from pain, chronic pain, and you're certainly one of this region's top pain management doctors. So we wanted to have you please begin by telling us about some of the treatments that can help those folks.
There are a variety of pain treatments these days, Rocco. The latest advancements being in interventional pain management. Some of them can help treat chronic pain conditions as well as acute pain problems. Most of the times patients come here with debilitating pain, and they have tried multiple interventions in the past. They have had mixed responses. So when they come here, they come up with some hope to get treatments.
So you're seeing the patients who may have gone elsewhere and it didn't work.
Correct.
And we all know how debilitating pain can be, not just for each individual, but for their family and friends, significant others. Quality of life is greatly affected.
Sure, absolutely. A chronic pain patient's health depends on the other family members.
Yes, indeed. So some of these treatment options that are in your toolbox, if I may use that phrase here, with all your vast experience, having done so many procedures over the years, can you please let the folks know how you can help them?
There are a variety of treatments, especially for back problems and neck problems. Some of the interventions I do include epidural steroid injections, radiofrequency ablations for treating arthritis in the back, which can be up to 40% of the back problems can come from arthritis in the back. So the radiofrequency ablations help treat those pain problems. And it can be kyphoplasties or minimally invasive procedures like kyphoplasty, spinal cord stimulator therapy, or it can be a PRP therapy, which is a regenerative medicine therapy.
Yes.
It's the latest advancement in this.
I wanted to ask you about the vertebral compression fracture.
Vertebral compression fractures.
And what is that?
Vertebral compression fractures are fractures of the spine. Basically, it is a wedge compression fracture which can happen in elderly patients or postmenopausal patients due to osteoporosis. Osteoporosis is nothing but bone loss, which can happen in postmenopausal patients, women, or in elderly patients. When their bone mineral density goes low, the vertebral bone is more prone to be fractured. It can be a trivial injury which can result in a significant compression fracture for these patients.
And then obviously a lot of pain results.
Most of the times they are in severe pain, and it can be pretty debilitating, especially for elderly patients, because most of the times pain which can happen with these fractures gets aggravated with movement. and so they will be afraid to move. So most of the times they're bedridden, which can lead to some other condition or some other problems like pneumonia, and which can take a great toll on these patients.
And one of the modalities that you have here and you utilize in helping folks is the kyphoplasty as a treatment option?
Yes, for some patients who do not improve with conservative measures, which is your early mobilization, bed rest, pain medications, for those patients, kyphoplasty can be a treatment option.
And can you tell us about what kyphoplasty is for those watching who may not know?
Kyphoplasty is a minimally invasive procedure.
Okay.
There is usually a specialized instrument which is placed inside the fractured vertebra, and you can inflate a balloon inside the fractured vertebral body, which will create a cavity inside. And after it is done, then the balloon is deflated and retracted back, and then in the same instrument you would place cement, which fixes the fractured vertebral body and is restoring the height of the fractured vertebral body.
Very interesting. So on the kyphoplasty procedure that you just talked about and showed us as well with the model that you have, I wanted to ask you if you can, for the folks out there watching who want to know more about this particular treatment option, is this something that can be done in the same day? Is it something that takes an hour, 4 hours? And again, I put in the disclaimer that I'm sure that depends on each patient, his or her situation, but in general terms, what are they looking at?
Yes, most of the times it is a same-day procedure, typically done in less than an hour. Patients, they come to the site on the same day and get the procedure done and leave after a few hours.
Oh, okay.
It is done typically with local anesthesia with some sedation, IV sedation.
Okay.
The best part of this treatment is most of the times patients can be pain-free immediately after the procedure.
Oh, so they're going to see instant results in many cases.
That is correct. That's correct.
After all that pain and all that suffering,
absolutely.
Talk about major relief.
It may not be for every patient, but most of the time.
If you could tell us a little bit more about what specifically PRP is and how it's utilized.
Yes, the PRP is a platelet-rich plasma therapy. Typically the patient's own blood is taken here, about 30 cc's of blood usually, and it is centrifuged in a special equipment. And this separates the platelets from rest of the blood elements, and the platelets are then mixed with plasma and then injected into the site of injury. And this brings in all the growth factors and all the healing elements into the area of the injury, which promotes or fastens the healing.
In a very natural manner.
Correct.
Exactly.
Correct.
And non-invasive.
Correct, absolutely no risks involved because it's patient's own blood.
Exactly.
And most of the times.
And I understand all these treatments and all the other services that you offer here is all done at your facility here in Glenndale.
That is correct.
It's not like some other treatments where doctors outsource it to a different center or different doctor. In your case, everything is done right here.
It is done in the same location, and we do offer sedations for some procedures.
Sure.
But most of the times, if we don't take patients anywhere else.
Yeah, so that's a key point because, they're getting that comfort level, that trust level with you, and to know that you'll be their doctor throughout their journey to help relieve the pain and feel better and get better. And I wanted to ask you if you could please elaborate a little bit more about the types of problems that these two treatment options really help address, because I know you touched on that.
Yeah. PRP typically helps with chronic injuries or acute injuries for that matter, like injuries to the tendons, rotator cuff problems, tennis elbow, meniscal tears in the knees. It can help in the plantar fasciitis, foot pain. Anywhere where there is compromised blood supply, where the tissues are taking too long to heal. Kyphoplasty is typically done for patients who have not responded to the conservative treatments with a vertebral compression fractures, 1 or 2 in the region, and this is typically done after doing the conservative treatment for about 6 weeks, 4 to 6 weeks.
We're now going to hear from a patient of Dr. Chada and Synergy Spine and Pain Center. Welcome, Renee. It's a pleasure having you on our program today.
Thank you very much. I'm glad to be here.
Well, we always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to ask you, if I may, Renee, if you could please begin by telling us what kind of pain you were experiencing prior to coming here to Dr. Chada.
I had back pain, hip pain, my lower back, my mid back, and the back of my neck. The pain was excruciating.
I'm sure obviously it was really affecting your life when you're talking about debilitating pain like that.
Absolutely. I would say definitely the majority of my days were filled with pain and was trying to find some kind of solution, something to help me, and I found Dr. Chada.
Well, what happened next, if I may ask?
Walked in and she took me as a patient, and I explained to her. She took her time with me. She wanted to know every detail of what was going on, and I felt a great relief because she heard me. She heard everything what I was saying. She took into account what I was experiencing. She never dismissed me, and it was just a positive relationship from there. And her having that trust in me and me having that trust in her, after going through a couple of doctors, I felt very confident that she would find a cure or something close to it, and she definitely found something close to it for me.
And then what was the treatment option that took place to help you?
She gave me some facets in my back, and it definitely helped relieve the pain. I would say before coming to her, my quality of life was about 35%, and then coming to Dr. Chada, my quality of life is now up to 85–90%.
So to hear that you're up to 90% now, from 35% prior to coming to Dr. Chada, and having your quality of life back, that is wonderful news.
Yes, I tell everybody the wonders of this beautiful doctor. She is the most caring, she's heartfelt, she's trustworthy, she's loyal. I mean, I'm loyal to her, she's loyal to me, and just been on this journey with her, and it's just been the absolute best for me. I mean, to the point where I could barely walk to now that I can do some exercising, like I can go to the gym and, you know, and just kind of work out, and it's just been wonderful, where before I couldn't do that.
And that says everything.
Yes.
And on that note, Renee, we'd like to thank you for joining us, sharing some of your experiences, and being a guest on our program. It was a pleasure having you on, and so happy to hear that you're feeling great again.
Thank you. Thank you for having me.
Thank you. We're now back with Dr. Chada. Yes, I must say, we just heard from Renee, and she's got her quality of life back. She's even exercising, for God's sake, when she could barely walk before she came to you.
That's great to hear, Rocco, but most of the patients are like that. They get their life back after getting these treatments, and most of them, they go back to work if they have not been to work. And it is, it's a great therapy.
We're literally out of time, Dr. Chada, but I wanted to ask you, before I let you go, you and your center, Synergy Spine and Pain Center here in Glenndale, Maryland, with another location to come, from what I understand, in the near future, right? Because you've got patients already coming from throughout the DMV region to you, and even beyond in some cases, because of the kind of results that you're getting your patients. But you really have established a reputation for excellence. I just wanted to ask you what you feel really helps separate you and your practice apart from many other pain management doctors.
As as my patient has mentioned, it is your personal attention to the patient, and you always have to listen to your patients. Patients come here sometimes after failing multiple treatment options with a hope, and it is important as a physician to give them your personal attention, to listen to your patient as not just as a physician, but as a human being, and understand their pain, and in that way you will be able to connect with your patients better. and at the same time see what has been left in their treatment options, which was not touched by any other doctor or physician, to help these patients regain their normal life.
Yes, indeed. Well, you're doing tremendous work. Certainly one of this region's top interventional pain management doctors, and we were very proud to have had you on today. And on that note, I'd like to thank you for joining us, educating us, Dr. Chada, and being a guest on our program. It was a pleasure having you on.
Thank you. It's my pleasure as well.
And we'd love to have you back on in the future.
Absolutely. Thank you.
Thank you.